Hi, my name is Dr. Tessa O'Gorman. I work part-time as an infectious disease research registrar in the Mater Hospital Dublin and as a senior medical officer with public health in Area A. Today I will be describing HepCare Plus, a service enhancement project to improve the primary care identification and treatment of hepatitis C virus in high-risk individuals in the community setting. There are an estimated 20 to 40,000 people living with chronic hepatitis C in Ireland, of which 60% of those have not yet been diagnosed. This implies an issue with identification, screening, and/or engagement of individuals with hepatitis C. Hepatitis C virus disproportionately affects already vulnerable population groups, including migrants, prisoners, homeless, and people who inject drugs. Furthermore, this cohort of people, despite being those with the greatest need, are often not captured in traditional health screening methods and treatment pathways. The current treatment for hepatitis C is highly effective, with eradication of the virus in over 90% of cases. From 2016 to 2019, at the Mater Hospital was chosen as one of 4 sites that participated in HepCare Europe, a co-funded European Commission and HSE project. This was an integrated, peer-led model of care, involving participation from primary and secondary care to enhance the identification and treatment of hepatitis C in high-risk groups. There were 5 main components outlined, including HepCheck, which involved hepatitis C virus community screening, HepLink to link those identified with hepatitis C to secondary care for treatment, assessment, and/or initiation, HepFriend to provide intensified patient support with a peer support worker and dedicated community nurse specialist, HepEducation to educate service providers, and finally HepCost to evaluate the cost of the project. Today I will describe HepCare Plus and its components, which is a continuation of HepCare Europe and involves HepCheck, HepLink, and HepFriend, and took place between August 2019 and September 2021 at the Mater Hospital Dublin. With the aid of a peer support worker and a community hepatitis C nurse, it aimed to build on the network and achievements of the HepCare Europe model, to further identify those not accessing care and to facilitate prompt assessment and treatment of those diagnosed with hepatitis C. Specifically, HepCare Plus aimed to commence an additional 100 individuals on hepatitis C virus treatment who may not have otherwise been identified and/or engaged with treatment services. The peer support worker was specifically trained and had a lived experience with hepatitis C. The peer support worker was central to the project and provided support at each step of the patient's journey, from screening and identification right through to treatment completion. There were 2 main pathways used to enhance the primary care identification and treatment referral to secondary care at the Mater Hospital. Firstly, the peer support worker led a community screening initiative, regularly attending community addiction and homeless services. At these locations, service users were offered peer-facilitated screening, provided with up-to-date information with respect to transmission, testing, and treatment of hepatitis C, and where appropriate, they were offered a direct pathway to treatment. Secondly, the hepatitis C nurse specialist intervention established for HepCare Europe was strengthened and expanded for HepCare Plus. The nurse provided dedicated education support and a clear pathway to treatment for primary care and hospital referrals. Whether an individual was diagnosed with hepatitis C via the peer support or nurse-led pathway, they were all offered and all availed of peer support to varying levels as they navigated through the steps to treatment completion. Between August 2019 and December 2021, 109 individuals were assessed for hepatitis C virus treatment and availed of peer support under the remit of HepCare Plus at the Mater Hospital. The total number of individuals screened and tested in the community is unknown. However, of the 109 individuals referred to secondary care, 24% of referrals were received from general practices, 23% of referrals were facilitated directly by the peer support worker, 21% of referrals were from hospital settings, inpatient and outpatient, 20% of referrals from homeless services, and the remainder of referrals from addiction services. Of the 109 individuals assessed for treatment, the majority, at 76%, were male. The median age was 43. 5% of individuals were co-infected with HIV. Data was available on the previous awareness of hepatitis C virus positivity for 94 individuals, of which 85% of individuals were aware of their positive hepatitis C virus status for more than 1 year prior to engagement with HepCare Plus. The majority were referred to and assessed by the Mater Hospital Infectious Disease Service. Moving on to the results. At the time of writing, 92% of the 109 individuals assessed for treatment had commenced treatment. 3% of individuals are due to start treatment in the coming weeks. 1 individual's treatment was deferred, and 4% of individuals were lost to follow-up. Of the 100 individuals who initiated treatment, 62% had achieved a sustained virologic response, 4% had completed treatment with SBR assessment not due yet, and 32% had completed treatment but did not attend for SBR, and finally 2 individuals' treatment defaulted. In terms of lessons learned, HepCare Plus demonstrated a high level of treatment completion with peer support work engagement. In the project timeframe, over 1/3 of individuals treated for hepatitis C virus at the Mater Hospital availed HepCare Plus instigated peer support. Despite significant interruptions to the project and extension of the original timeline with the COVID-19 pandemic and HSE cyber attack, the HepCare Plus model proved to be a sustainable model to provide care to high-risk, vulnerable individuals. Notably, a significant number of individuals were previously aware of a positive hepatitis C virus status, highlighting the ongoing need to address the barriers preventing marginalised groups from engaging with care. Importantly, HepCare Plus is likely to be cost-effective, based on previous evaluations from Ireland and the UK, which indicate the potential cost-effectiveness of community-based case screening followed by linkage to care. Looking to the future, this report reiterates the defining role of peer-led community interventions in hepatitis C virus treatment engagement and the need for continuous open-ended care. HepCare Plus provides a sustainable framework to meaningfully combat hepatitis C virus in Ireland and achieve the United Nations Sustainable Development Goal of hepatitis C virus elimination by 2030. I would like to thank all the staff at the Mater Hospital who are involved in HepCare Europe and HepCare Plus, as well as the HSE and participating primary care services for their support. Many thanks for listening, and I would welcome any questions.